In today's show, I wanted to share with you an alternative therapy that you may have not considered or even known about. It's known as IV therapy. When we hear the word IV, most people immediately think of the IV sacks you get at the hospital. But did you know that IV treatments go way past that? I'm here with Jamie and Aaron at Infuse LV to tell us more about it. Thank you for joining me, you guys. I want to just kind of educate our viewers on what IV therapy is and how they can feel more comfortable even approaching it as an option for them. So tell us a little bit about what IV therapy is.
As the name suggests, IV therapy is just a way to administer hydration, electrolyte fluid, or medication, supplements in the intravenous form. So it's going to be direct absorption immediately into your bloodstream, which is why it's so effective. You know, people that are nauseated or have certain ailments or just dehydrated, they just can't get the relief from taking it orally. Also, with that direct absorption into your bloodstream, it's able to bypass your stomach acid, which does destroy most of the supplements or that you take orally. So the efficacy and the recovery time for these patients is tremendous. Usually notice feeling better immediately, or at least the same day. Just drastically, it's just very efficient.
Okay, so how did you get started in doing IV therapy?
He started first. He was about 3.5 years ago. So he is a paramedic for 10 years. Got sick of the ambulance, and original owners were 2 firefighters and our medical director. So he knew a lot of firefighters. They asked him to come work for him. So he thought this is a great alternative to ambulance work. So he worked here for a year before I came in. Then the board of nursing came in and said that in order to administer an IV when the doctor's not on site, that has to be a registered nurse. So I'm a registered nurse. So I came in 2.5 years ago. So we actually met here at work. But I had 10 years of ICU experience, and I was burned out by the politics of the hospital, which is not abnormal. And yeah, this is so much better. We get thanked all the time. It's more up our alley. We're very much into like the natural, holistic, heal yourself with vitamins instead of medication.
Preventative medicine.
Right? Yes, absolutely. Yeah. And that's exactly why we're here. Yeah. So, and that you actually brought up a very good point. So there's quite a few of these nationwide. IV therapy is growing. So you can't just be anybody and open up an IV therapy. You have to be in the medical field. You guys you're a licensed nurse.
Absolutely. It's it varies between states, but you at least need some form of a medical director, a nurse practitioner should suffice, and very dependent upon jurisdictions, state to state. There's a lot of gray area, and the problem is like she was saying, when the health district came in and to all these places, there's no precedence. Telemedicine, doing the FaceTime with a doctor is the way of the future. It saves time. It's especially with COVID, or it's just the way to do it. So I would say, I know this is getting a little off topic, but for anyone that's seeking treatment, you absolutely want to ask those questions. Do you have a medical director? What is the licensure of the person administering the treatment? Some places may have paramedics, some may have nurses, but I think that's that's the standard.
To ask them what's in the bag, because there's a lot of people that will say it's a proprietary formula,
Ah.
And if you're putting it in your body, you want to know exactly what's in your bag. So that's important.
Agreed. The IV bags. You guys have a lot of different treatments, and I've seen even more treatments out on the internet. What are some of the most common ones that people can come across and know that they'll most likely be available in most places?
Definitely the popular ones like B12, vitamin C. There are a lot of similarities between clinics, but we really pride ourselves on being a local clinic. We have lots of cancer patients, lots of patients with autoimmune conditions, various vitamin deficiencies, and we just we really gear our treatments for them, and try to do as much as we can. If they have cancer and need those higher doses of vitamin C, those aren't treatments that typically the ones that are on the strip, that are in the popular strip hotels, that are mostly catering to hangovers.
Yeah.
We do have a hangover IV, it works great. But whether you have an infectious process like a virus or a bacteria infection, or you have a hangover, it's the same symptoms, just different etiology. So it works great for either. But
and that can be scary for some people, knowing that they're going into a clinic where there are sick people. So do you treat people with COVID?
Yeah, so that's a great question. So we do, right now we are only doing home deliveries for COVID, active, confirmed COVID clients, and obviously wear the proper protective equipment.
If there was something that our viewers were to try to boost their immune system, what treatment do you guys have that you would recommend?
We actually created one just for the COVID. It's called our Immune Boosting IV, actually. And we made it a little bit more affordable, but without all the amino acids. So it has a high dose of vitamin C, has glutathione, which is the most potent antioxidant, zinc, magnesium, the B vitamins 1, 2, 3, 5, 6, and 12. So we made that and made it less expensive than our health and fitness, which has all of them. So we made that plus the glutathione, which is the thing that they need to boost their immune system. So
you kind of are also doing custom cocktails for people,
Absolutely.
I'm hearing,
Mm-hmm.
and now you've developed this for anybody that wants to boost their immune system naturally. This is a good way to do it. I know in the desert we're always dehydrated, so that's another good thing to do.
And we mix everything back in our lab shop, and we don't like if somebody wants no magnesium, we can leave out magnesium, or so we can customize it to whatever they want.
We don't make it till you order it.
Yeah.
So
I
it
don't know
doesn't
if I
just
can
sit
say
there.
Yeah.
I think most people assume that IV bags are just kind of hanging out in the refrigerator in the back room, and then when you come in, you guys hook them up, right? So that's not the case.
Not for us.
We have our Southern Nevada Health District mixing room, approved room. Everything is stored per, manufacturer recommendations, whether it's in the refrigerator or, on the shelf.
Is that common? Is it common to mix on site and not have them pre-made and stored?
I couldn't answer that. I don't know.
Yeah.
So as a nurse, when you were in the ER, and those IV bags were there, those must have been prepared and ready to go.
So the ER bags that you normally get, it's just saline.
Saline, right.
So we don't add vitamins to your bags in the emergency room. If anything, they'll add like an antibiotic to it or something. And you mix those yourself still as a nurse, or the pharmacist will mix it right before it's given. But generally just the fluids they give, that's really just what they give. They don't treat you in the hospital with vitamins generally.
So viewers don't need to worry about expiration dates on bags or...
Yeah, everything that we have is individually compounded, organic, and it's, all the vitamins are in their purest forms. It is really important. It's been given as quickly as possible after it's prepared, because after a while the vitamins will break down, and they will affect each other. So anything that we make is not until, the client arrives. And then if it was a delivery service type of situation, we would just discard it.
Are there any side effects to doing IV treatments?
Well, yeah, there's better sleep, more energy, better skin.
All good side effects.
Energy.
But no, but there are a few ones, which most of them can be avoided with proper screening with our clients. So we're obviously not going to give a whole liter of fluids to somebody who has congestive heart failure. We're not going to give Toradol to somebody with kidney disease or with a known allergy. We're not going to give them something they're allergic to. But besides that, rare, like you can get bruising or pain or infection at the site of the IV. But really, that's mostly it.
Very rare.
Very, very rare. And honestly, in 2.5 years, I haven't seen any bad side effects besides a little bruising.
Probably safe to say that if you're going into an IV clinic, to be very open about what you're taking and any herbs and medications that you might be on, supplements, just like you would with your doctor, so they can be best prepared to help you in the best way possible.
Absolutely.
All the vitamins we offer, they're all water soluble vitamins, and so you don't run the same risks of the toxicities you would like fat soluble. So if anything, for them mostly, you'll just your body will naturally get rid of it.
I've looked at other places around town, even outside of town, just to kind of see what the price points are, and some of these places I'm just shocked at the price tags. They're quite up there, like in the hundreds, sometimes even in the thousands. And
Absolutely.
I was really surprised to see the quality of IV treatment you guys have, and the price point is so very much affordable. Will you share what a common price point, like what can people expect to pay for, let's say they come in for the immune boost or a vitamin boost of some sort? You know, do you have a price range that you can kind of give them an idea?
Yeah, sure. So just for basic hydration for just the fluids, it's $99. We do the personalized cocktails. So that can affect the price in however you want it to. Our one bag that has all the vitamins that we carry in the shop is $179, so it's still affordable. Our immune IV is $149, and our hangover is $219. If we go to your house, we do charge a $99 delivery fee if it's between 8 a.m. and 8 p.m. If it's after 8 p.m., before 8 a.m., it's $199 extra on top of the price of the IV.
Okay. So
Anywhere from $99 to $250 basically, and
But
that's
it
still
can go
priced.
up. It
That's
still can go
priced
up, but yeah.
quite well,
Yeah.
considering
Yeah.
you guys are going to somebody's home to,
Right.
to deliver this.
Right.
So is there an option, like in the hospitals, for people to use their own health insurance to cover that cost?
Unfortunately, we don't bill insurance ourselves, but we do have many clients that submit their receipts to their insurance to get reimbursed, and then we have a lot of clients that use their FSA or their HSA to pay for it, and it's individualized, so I couldn't tell you which insurance does cover it or which plan or
But
FSA or
there is a
HSA.
possibility,
Yeah.
so we
There-
should look into
there has
it.
been one. She had I believe Lyme disease. I believe she was able to get that paid for, at least partially paid for. But as we know, insurance companies can be fun to deal
Difficult,
with.
yeah.
So,
Yeah.
but I mean, if you compare that to a deductible at an ER, quick care, so many things that. And we're not saying don't go to the ER. Always
Yeah.
call 911. But there are clients that. They'll get a debilitating migraine, which is usually caused by dehydration,
Mhm.
and or they'd be pregnant and just need a fluid replacement. And these are all clients that instead of spending 10 hours at the ER, your $500 deductible, and your entire night, you just you could be tucked in, get the service in bed, usually with way more relief than you're getting from the emergency room,
Sure.
with less than just the
Waiting
copay.
2 hours
And
and
less
Yeah, you're getting
possibility of other
Yeah.
sicknesses.
Better fluid quality, better, you're actually getting vitamins, vitamin C that's actually going to fix you, and not just mask it with the medications. So.
I guess a follow-up question to this would be, how often should somebody do a treatment for something like an immune boost, right? How long is that going to boost my immune system for before I start to feel it wear off and need to maybe come back for another? I know it's individualized.
It's so individualized, yeah, because of ages, gender, metabolism, disease state. Generally, it lasts in your system for about a week.
But, okay.
But, we do have people that do it once a week. We do have people that do it every 2 weeks. We do have people that do it once a month. Some that just do it when they get sick. Some that do it just when they're going to travel. So it's very individualized because we're all individuals.
If you don't have a current insult, infectious process or hangover, usually the first day of the treatment, your body feels more relaxed. So the fluid just kind of calms your body down. And then after a good night's sleep is usually the next morning is when you feel the energy benefits from the B vitamins. And then, like Jamie said, usually it lasts at least a week. But what we like to do is we'll do an IV 1 week, and then the next week we'll do a shot, like a booster shot in the muscle. Almost all of our products can be given intramuscular as well, except for a few like zinc and Pepsid, I believe. But so we like to space it out. Sometimes we don't have time for an IV, or we don't the whole production, so we just do a quick booster shot. Like that glutathione she just touched on, that's the body's the mother antioxidant that it's in all your body systems. It's the one your liver makes naturally to detox your body, so it literally helps with everything. The best thing for your skin, immune system. It cleans you out so well from the inside out that most girls actually seek it out for vanity reasons. Not just girls,
Aesthetic.
but it just makes
Aesthetic.
your skin's a reflection of your immune system. So
Sure.
instead of just putting on this stuff, it cleans you from the inside out. So that's one of our most popular ones, and those do you can't take them orally because your stomach acid's so strong it won't they'll claim that we have this special formula that bypass your stomach acid and it will get absorbed, but the research isn't out there. All these companies, there's no double-blind research, unbiased research studies. So anyway, those are great, handle great in the muscle. You can even, a really popular one, a lot of people do the glutathione with the B12, and then they can just do that all in one quick shot. So.
Okay. Would you consider this a good option as a replacement for your daily vitamins?
I wouldn't necessarily say replacement, but as an adjunct, because a lot of things you can't take via intravenous injection. You can't take it that way, so you have to take it orally. However, when you take a lot of vitamins, you only absorb about 30 to 50% of what you take, whereas you get 90% absorption when you do it through the IV. So I wouldn't replace it completely because you can't take everything through your IV, but yeah,
and
it's a very good adjunct therapy.
Yeah, if you're if you're doing at home, like B12 is another very sensitive one, or you may take that orally. You may eat meat and seafood every night. Some people will you can ingest it just fine, but it won't you won't transfer properly in their body. It won't get into the right system. So you could be taking your B complex every morning. Mm-hmm. Like I said, a lot of these supplement manufacturers, they don't tell you like, oh, it's most of it will probably, or all of it will be destroyed before you actually reaches your small intestines to be absorbed.
Yeah.
So I would say if you're curious or are these working for me? Just come in, get a B12 shot, get an IV, or see if it gives you energy, see how it makes you feel. So some people they could take it and then but just that, like we touched on earlier, the route of absorption via IV or in the muscle is just it's just a lot more effective.
So I know a few people personally that have huge needle phobias. Mm-hmm. They want to try all these new things. Now it's a little different experience here. We'll show you a little bit around the clinic so you can see the atmosphere here, but this is very relaxed, very living room feel, right? You're trying to make people feel like they're at home. Yeah. As opposed to the hospital where everything feels very sterile, busy, and nerve-wracking. To me, it's always nerve-wracking too.
Yes.
How do you guys go about handling people that want to do this but have needle phobias?
Well, first we let them know that I have 10 years of ICU experience. I was on the IV specialty, and he has 10 years on the ambulance. Between the two of us, we haven't ever had to actually turn anybody away because we couldn't start their IV. We were the people that people would go to when they couldn't start their IV, so we rarely miss. So that's a good thing for us, for them. Secondly, we tell them we're going to look a couple times, so we only have to poke you once. So that kind of helps calm them down. And his favorite saying is, it could be worse. You could like needles and have a worse problem. So
it's a good thing not to like needles.
And it gets them to kind of relax and laugh a little bit.
And then and most people, we explain the process. Most people don't know or their only experiences with like blood draws or donating blood, because a lot of times they'll leave these big, usually big needles in your arm, and they'll just leave the needle in there. So a lot of times you're sitting there, they don't take the needle out, and you're like, oh, is it gonna pierce it? It's but we use catheters, so it's most people don't know that you actually remove the needle. So a lot of people, are you good? And you're like, we're good, and take the needle out, and they hear it, and then they're okay, and then they breathe again. But it's just explaining it to them. You can bend your arm. There is no needle in there. It's a little pinchy, but it's it doesn't hurt any worse than a pimple. Really, it's just mostly.
How long does one have to sit through one IV pack?
It's generally about 30 minutes to an hour. It depends. If somebody's like, I'm in a hurry, they'll ask for a bigger, they know the process, they'll ask for a bigger IV needle, and they're okay with it. And so they'll go in, some people can go in like 15 minutes.
Wow.
But then there's some people that kind of have a little bit of anxiety and they want to just go slow. And so we can slow it down. But most people are done by an hour.
If somebody were to Google IV therapy in their area, and let's say they're not in Las Vegas, give us like the top 5 things that you would ask the companies you're calling to confirm that they are legit. This is where I want to go.
I would definitely start with the reviews, because you'll know, and start Yelp, Google reviews. Usually get a good feel for it. And then just call them, and whether they're on site or you have to contact them, they should always have a medical director, a nurse practitioner, some sort of physician that you can speak to face-to-face or via FaceTime. So as long as you have any questions, that'd be the time to ask. Same with us. You can, our medical director is always around, and so that's the most important. The full disclosure, always, on our website we list every ingredient and the amounts of the ingredients, because some places are like, oh, we can't tell you what's exactly in there, but we can kind of tell you. So you need to know exactly what you're putting in your body, and there's no reason not to. And then, you always, we do, like I said, the brick and mortar location. You can go to the actual place, and you're not like, hey, is this being done out of a truck, or which maybe could be done successfully.
But I would also make sure they open the packages in front of you. You're obviously not going to want to use a reused needle or something, So make sure everything is all in sterile packaging. That's another way to know.
Seems like common sense,
it's pretty legit, but there's a lot of shady people. So
you have to post your business license, just like you always see when you go to different restaurants and stuff. So
you can also look up their credentials online to see if they have any like malpractice infractions or anything against them. So.
Well, are there any additional thoughts you want to leave our viewers with?
Yeah, I mean, it's really it truly is for everybody. There's not one patient group that doesn't benefit from this. It's huge in other countries that value their healthcare and their citizens' health. We practice preventative medicine. So I just really wish, thankfully for the COVID, something positive is that a lot of people have been, searching alternative methods that actually work. So, with our locals, they really, they know. They come in and they start feeling that little scratch, and they come in, they're like, all right, it's flu season, which is in September, by the way. Yep. It's coming up. So they get that little tickle, and they're like, they know to come in, and they come in, they get their IV, we don't hear from them. I mean, there's really, usually 9 times out of 10, we don't see them back. This year, well, we see them back, but not for the same install. It's usually, overnight, people say, like, I woke up and I felt better than I did before I got sick. So it really is tremendous. That glutathione, combined, especially with that vitamin C, they're just really potent antioxidants. And, if they can stop or prevent cancer, they can definitely, definitely kill certain viruses, bacteria. Obviously, we can't make any promises, but these are things that other countries do. As soon as you get sick, you get your glutathione and your vitamin C infusion, and then guess what? You don't get hospitalized with your pneumonia and your secondary bacterial infections and all that. So,
Jamie, Aaron, you guys have been a plethora of information. Thank you for joining me today. As you guys can see, there are a lot of options for you other than herbology, other than pharmaceuticals, even other than essential oils. This is something that if you haven't explored before, you might consider looking into. So IV treatments are pretty extensive. We have everything from hydration to vitamin infusions, immune boosting infusions, health and fitness, biotin for hair, skin, nails, and of course the very famous hangover infusions. But it goes further than that. The absorption rate is a lot higher, and you have a lot more options as far as what you are putting into your body, and know that it's clean, pure, and absorbable. Do your research to make sure that you are going to a reputable company. I've included a link in the description section to Infuse LB and highlighted a few of their top therapies. I hope you were enlightened, and na zdraví, to good health, and I will see you next time.